Good morning from Sydney. My journey with type 2 diabetes. From misdiagnosis to recovery. A personal story of hope and science. A true case of reversal without medication or surgery. Compiled by Dr. Siva Navaratnam and ChatGPT. This is a true life experience, not just mine, but shared by many people around the world who have achieved similar results through scientific lifestyle changes. I would like to thank my children, Dinan and Jazara, for helping me in the production of this video. A disclaimer. This presentation is based on the latest scientific evidence from world experts in metabolic health, Dr. Jason Fung, Dr. Pradeep Jamnadas, Dr. Robert Lustig, and Dr. Roshani Sanghani. We, ChatGPT and I, did not invent this plan. We simply simplified, compiled, and organized proven principles into a practical plan that any non-medical person can follow safely. Each person's body is unique. What worked for me may not be identical for you, but many around the world have achieved similar results through these same scientific lifestyle changes. Please consult your doctor before making any changes to your diet, medications, or exercise routine. I would like to sincerely thank ChatGPT. Without their assistance to verify, this would not have happened. When I was diagnosed with metabolic diseases, I wanted to understand the science, not just take medications or surgery. That's where ChatGPT came in. Together, we summarized and simplified and verified information from world experts in metabolic health, turning it into a clear, practical plan that I or anyone else can follow. ChatGPT helped explain and verify complex science in simple terms, organize the ideas into free educational slides and booklets, and make this information available to everyone free of charge. This collaboration transformed confusion into clarity and knowledge into hope. About me, I'm a medically trained anesthetist. I retired after a post-operative complication of cataract surgery where I developed phoria, double vision. I did not want to put my patients at danger. During my medical education, I received no formal training in chronic metabolic diseases or nutrition. Together with ChatGPT, we compiled, compressed, and simplified a practical approach to managing metabolic diseases. By balancing 3 key hormones and incorporating 6 lifestyle changes. This plan has been followed by more than 100 people, and similar lifestyle first approaches are used by experts such as Dr. Jason Fung, Dr. Pradeep Jamnadas, Dr. Robert Lustig, and Dr. Roshani Sanghani, a US trained endocrinologist practicing in Bombay. How it all began. My metabolic problems began in 2010. I started to gain weight. My waistline increased. I became tired. I began snoring loudly with pauses in my breathing at night. Routine blood tests showed a mildly raised ALT, an early sign of possible fatty liver, but at that time, no one connected these changes to insulin resistance. There were a lot of missed opportunities. Doctors focused mainly on my blood pressure, prescribing medication without asking about my weight or my lifestyle. At no time were any screening tools applied, although they were prescribed by the Royal Australasian College of General Practitioners, such as the OSD risk score or the FIB4 index, simple tools that could have identified insulin resistance much earlier. Every few years, when I did my blood tests, it was normal, and I was reassured that I was not a diabetic, had no cirrhosis, and no liver damage. Just take your blood pressure medications and you'll be okay. The shock diagnosis came in 2024. In 2024, after a severe urinary and prostate infection, my doctor ordered a full blood workup, including a HbA1c. The result was shock. HbA1c 8.1%. Fasting glucose 7.2 millimoles per liter. I was suddenly labeled as an advanced type 2 diabetic. I asked the doctor to repeat the test, but he said, no, it can't be done. You've got to wait 3 months. I asked him to consider other options, and I was told simply, take the medication now, or you'll risk a heart attack or stroke. The turning point. After my diagnosis, I refused to believe that medication or surgery was the only answer. I wanted to understand why this had happened and whether it could be reversed. I began spending hours listening and watching to videos by world's leading experts like Dr. Jason Fung, Dr. Pradeep Jamnadas, Dr. Robert Lustig, and Dr. Roshani Sanghani, learning about insulin resistance, fasting, metabolic health, and nutrition. With the help of ChatGPT, we summarized, compared, and organized their key findings into one simple practical tool. Around the same time, the American Diabetes Association, the ADA, in 2021 updated its position, acknowledging that type 2 diabetes can be placed into remission through sustained lifestyle changes, especially those that improve weight, insulin sensitivity, and liver health. Wow! We tested the plan. I got to be honest, we did not invent the wheel. We simply summarized, modified, and made it practical so that anyone, including a non-medical person, could duplicate the plan safely. If you want to make changes, please discuss this with your doctor, especially if you are taking medications like insulin or diabetic medications or hypertensive medications. From day one, I recorded everything: weight, waist measurements, blood pressure twice a day, fasting blood sugar, daily pricks on my finger, and urine sugar using the dipsticks. Within 7 days, my fasting sugar normalized. Urine sugar disappeared. I just went to my pharmacist and got it confirmed. And both fasting and post-meal sugars were normal. She was shocked too. By day 10, my snoring stopped. I was sleeping now on one pillow instead of 3. I slept like a baby. No more sleep apnea. My kids didn't have to kick me to wake me up to breathe. I was full of energy. I was no longer feeling fatigued. I felt I could have climbed Mount Everest. During the same period, my intraocular pressure, which had been 19 to 21 millimeters of mercury, requiring urgent surgery. It was so urgent that my eye surgeon discouraged me from even getting a second opinion. I was told, get the surgery, if not, you're going to lose your vision. It fell into normal range within 10 days. And I confirmed by a tonometer. On day 14, my urine dipstick showed ketones, just as Dr. Jason Fung and Dr. Pradeep Jamnadas described. My body had switched from burning glucose to burning fat for fuel. 3 months later, the results. After 3 months, I repeated all my blood tests, and every single result came back normal. Weight reduced from 19 kgs to 72 kgs. That's 20% weight loss. Waist from 113 centimeters to 92 centimeters. No loose skin or sagging of my face. I look younger. My eye pressure dropped from 19 to 21 millimeters of mercury to 10 to 13 millimeters of mercury, and this was confirmed by a senior ophthalmologist after dilating my pupil. My CT angiogram, CT calcium score, abdominal and liver scans were all normal. I did a carotid ultrasound, a CIMT, carotid artery intima media thickness. There was no plaque, not even soft plaque. Some doctors were amazed, others skeptical. But this was not luck. It was science, discipline, and consistency. Coming next. In this video, I shared my personal journey, how I discovered the real cause of my condition and prove that not only type 2 diabetes, but many metabolic diseases like hypertension, raised intraocular pressure, sleep apnea, obesity, irritable bowel syndrome, gastric reflux, and fatty liver can all be placed into remission through lifestyle and science. You may not require medications, surgery, or even a liver transplant. In the next video, we'll explain the plan we used, how we balanced the 3 key hormones, and applied 6 simple lifestyle changes, now helping people worldwide regain their health naturally. Knowledge is powerful, but applied knowledge transforms lives. With gratitude and respect, this journey could not have been possible without the inspiration and knowledge shared by Dr. Jason Fung, Dr. Pradeep Jamnadas, Dr. Robert Lustig, and Dr. Roshani Sanghani. All their educational videos are freely available online. Please watch and learn from them. Their courage, their dedication have helped thousands understand that type 2 diabetes and other metabolic diseases can be improved and even reversed through lifestyle changes. Our next video is based on why, how, when, and you. These 4 words hold the key to change. Understanding why we start, how to act, when to begin, and you, the most important piece. See you in the next video. Thank you for watching.